Yeah, so there are a host of myths and misconceptions about psychopaths. What the psychopath literally means, the actual terminology, just means diseased mind. And I think because of that term, people confuse psychopathy with a host of other conditions. So, for example, I often get this question: how does psychopathy differ from psychopathology? Some people think it just means severe mental illness. That's really quite different. Psychopathy is a very specific type of mental disorder. It is not the same thing as mental illness in general. And in fact, ironically, classic psychopaths, if anything, tend to be immune from many types of severe psychopathology. If anything, they often are a little bit less likely to develop severe depression, severe anxiety disorders, because they probably don't have much capacity for emotional distress. Another big misconception, maybe the biggest, is that it is synonymous or very similar to violence. And now, it is true, studies show that psychopathy increases the risk for violent behavior to some degree, but that increased risk tends to be only modest. And in fact, most psychopaths are not particularly violent, although some are. And we certainly know the substantial majority of violent people are not especially psychopathic. So the link between psychopathy and violence is real, but in fact, it's only a modest one. They're by no means the same thing. Going along with that is the equation in many people's minds between psychopathy and serial killing. Again, they're quite different. Now, it is true, from what we've been able to tell, there certainly are a number of serial killers who are psychopathic, but many, if not most, serial killers are not markedly psychopathic. In fact, many of them are psychotic and out of touch with reality. And we certainly know the overwhelming majority of psychopaths are not serial killers. So again, there's no equivalence there. Another big misconception, another one I often hear, is equating psychopathy with psychosis. Again, very, very different. People who are psychotic are out of touch with reality. They typically don't know the difference between right and wrong. Again, psychopaths are almost always quite rational. They know what they're doing. They can reason through problems well. They can even reason through moral problems quite well. That doesn't necessarily, however, translate into people's actual moral behavior. So if you ask a psychopath, all right, is robbing a bank the wrong thing to do? Most of them can happily tell you that doing so is illegal, doing so is against the law, and sometimes they might even say, well, for somebody else, it probably would be a wrong thing to do morally. But for them, that's a different story. They often are very, very good at justifying their own behavior, finding post hoc rationalizations for those behaviors, and not seeing anything wrong with them. Again, that's very different from what one typically sees in people with psychosis, where people are out of touch with reality, do not know the difference between right and wrong, have a hard time reasoning through problems. As a result, another misconception I think goes along with this is that psychopathy is somehow a basis for an insanity defense. It almost never is. There are a few people who have tried psychopathy or a related condition called antisocial personality disorder as a basis for an insanity defense. Virtually always, psychopathy or antisocial personality disorder have failed spectacularly as legal defenses for insanity. The reason for that is, in almost all states, the primary basis for an insanity defense is some variant of not knowing the difference between right and wrong, the so-called McNaughton defense. Again, there are variants of this defense that are out there, but almost always there is a cognitive basis in part to an insanity defense, not knowing the difference between right and wrong. Psychopaths almost always will fail that cognitive prong precisely because they do know the difference between right and wrong in most cases.
The preceding program is copyrighted by Emory University.